Hello, Natalie here. Is it recording? Yes, it is. So this is step 3 and 4 for our action research project, and it's about speech pathology and palliative care. And I'm Natalie, and my partners are Kelly and Aaron. So step 3 was refining our action research question. Our original question was, what is an SLP's role in the end-of-life care team ethically, and how can this care improve quality of life? So we took some steps refining our question, and we decided to focus on patients with dysphagia to just kind of hone in on one aspect of patients in palliative care, and also it was refined to from describing the role of an SLP to the best facilitative management of swallowing. So this is a more of appropriate research question. So the refined question is now, how do SLPs best facilitate management of swallowing disorders in palliative care to maintain and improve safety and quality of life? Our refined question should then lead us to determine the outcome measures that are required to answer our question. Outcome number 1, quality of life survey. For the research question, the quality of life for swallowing and swallowing disorders should be measured. A survey will be provided by the speech-language pathologist that would help them gather the information about the patient's quality of life and of swallowing, and how their quality of life is affected by their difficulty swallowing. This can be done by giving the patients and their caregivers a survey and measuring the patient's swallowing quality of life. Outcome number 2, educating the patients and their caregivers about swallowing disorders, the swallow study results, and potential treatment and management. Once assessment of the patient's potential swallowing difficulty is complete, the SLP presents and explains the results to the patient and any caregivers involved. Explaining in depth and using lay terms will benefit the patient in fully understanding the results of any assessment completed, whether or not it was subjective or objective. If there is a diagnosis of dysphagia, it is an SLP's responsibility to make certain that the patient gathers all pertinent information in order to understand what comes next. SLPs will verbally present information to the patient, clarify any uncertainty or confusion that the patient may have, and follow up with treatment if necessary. However, if there is a chance that the patient or caregiver may not comply, a patient or caregiver may not agree with the SLP's recommendation and may not wish to follow through with them. Ultimately, it is the patient's decision if he or she desires to go through with therapy. Even though this may occur, the SLP still needs to educate the patient and caregiver by providing all relevant and important information about dysphagia. This is a measurement of how SLPs manage swallowing disorders in palliative care. Outcome number 3 is implementing suggested techniques and management. If the SLP suggests that using certain mechanisms, i.e. swallowing maneuvers, techniques, and thermal tactile stimulation, this will take part in the management of dysphagia. If the patient/caregivers are compliant with this recommendation, then this is another step towards overall safety management and improving quality of life. Data should be collected on how patients manage these techniques. If they are following through with the recommendations and they personally feel that it's assisting their swallow to improve their quality of life. It is important to note that this outcome can only be considered if SLPs think it's safe for patients to be on a PO diet, and if patients comply with the recommendations. If they do, data can be collected after a certain time frame to see how patients are managing these techniques and if their quality of life is improved. Step 4. Design a study. The purpose of our study is to study how SLPs facilitate management of swallowing disorders in individuals in palliative care, to examine the extent which this form of therapy improves patients' safety and overall quality of life. The method. The participants, we decided to take 10 participants with dysphagia who live in a long-term care facility. The participants will be chosen on time of entry into palliative care. Palliative care is usually when the doctor gives a diagnosis of less than 6 months left to live. So we will choose those with a recent diagnosis with approximately 6 months left to live to get the pre-data, and the post-data will be taken 1 month later, so with approximately 5 months left to live. Level of alertness. The participants will not be heavily sedated and remain cognitively intact. So they could be on pain medication, but they cannot be like very heavily sedated that it will affect their alertness. This also disqualifies severe dementia patients from being a part of the study because they're not cognitively intact, and they need to be aware and alert. Um, the patients will be 65 and older, present with symptoms of oropharyngeal dysphagia. Step 4. Design a study continued. So the procedures in planning our course of study are: number 1, administer participant information sheet, which is PIS, and consider and the consent form to participants and caregivers before starting therapy. Number 2, organize health data provided by patients that wish to share further information about patient's dysphagia. Step number 3, present the Dysphagia Handicap Index, the DIH survey, to patients to gather information on their perception of their difficulty with swallowing and how it is affecting their life. Step number 4, educate patients on dysphagia and explain in detail what it means to have a swallowing disorder. Make certain the patients understand their diagnosis and the potential steps to take. Number 5, present patients with recommendations of what will be most beneficial in terms of quality of life and safety while eating, if taking anything PO is safe or not. Step number 6, implementing facilitative feeding techniques and diet recommendations, and researchers will record all daily observations in a research journal. Step number 7, administer the DHI, again, to view patients' perception following the study, and also assess the patient's knowledge of their swallowing disorders in order to assess how thoroughly SLPs educated their patients. The rationales for procedure. So our procedure number 1 was to administer the PIS and the consent form. According to the Action Research in Healthcare textbook, the PIS form should be made available to all participants and collaborators of the study. This sheet should be informative, state the purpose of the study, why participants have been invited to join, the role of the participant, and any potential benefits and risk in participating in the study. Also, as a rationale for the consent form, the IRB states that obtaining informed consent is a basic ethical obligation and is a legal requirement for researchers. So a consent form is mandatory for any study. Number 2, gathering pertinent health information from each participant is crucial in removing extraneous factors and ensuring that all participants are at similar starting points. So this is the rationale for step number 2. Rationale for step number 3, the DHI is a research-based survey and the effects of dysphagia and quality of life. There were no significant differences between the experimental group with dysphagia and the control group with no dysphagia on how they answered the questionnaire in the validity study. So this survey has been proven to have test-retest reliability, and it is an easy to complete and a statistically robust patient-reported outcome measure for assessing the handicapping effect of dysphagia. So there was a study that validated the DHI to use with dysphagia and assessing the quality of life. Rationale for step number 4, counseling and educating patients in regards to their condition is a part of maintaining their informed consent and falls under the ASHA Code of Ethics, the Principle of Ethics, Section 1, H, I, and J, and then making recommendations for the patient after assessing them also falls into the ASHA Code of Ethics, the Principles of Ethics, I and H. Rationales for step number 6, implementing facilitative feeding techniques and modifying diets to record its effects on patients' overall quality of life is the purpose of this study. The techniques used will be evidence-based and will modify the diets to the safest and least restrictive. This will be determined by assessing the patient, and each recommendation will be tailored to fit the patient's needs. We'll be keeping a research journal on daily interactions with the patients, and this is a way to document what happens, to track how our ideas are evolving, to keep account of research and research reflections, which is a pivotal and essential part of action research. It's the researcher's reflections, and to keep track of patients' progress and daily health status during the experimental period before the final survey is given. So this is going to give us a daily insight into their overall health status and how they're doing on a day-by-day basis in terms of their motivation. And since they are in palliative care, their health can decline day by day. So this will also keep track of their overall health during the experimental period. And rationale for step number 7, the researchers will administer the DHI again to record an overall change in quality of life in terms of dysphagia management. This step is done to gather data to potentially support our research question that facilitative dysphagia management improves patients' overall quality of life. Measurements 1. So our first measurement is the DHI. It identifies the current diet of the patient, measures the patient's perception of their own swallowing difficulty by checking a box that asks sometimes, never, always, and for each question that it asks about its swallowing, and measures the patient's perception about the severity of their swallowing by circling a number from 1 to 7, 1 being normal and 7 being a severe problem. And over here you could see that it outlines, it's very clear, 1 is normal, there's a moderate problem in 2, 3, and 4, and then 5, 6, 7 is towards a severe problem. And this is a self-reporting survey, so everything is in the first person. It takes me longer to eat a meal than it used to. These are some sample sentences from the survey, which they have to rate as never, sometimes, always. Measurement number 2, assessing knowledge of dysphagia post-speech pathologist education. We'll provide a short list of questions to all patients before educating them on their knowledge of dysphagia, collect data on pre-education knowledge, present the patients with information about dysphagia in lay terms to make sure they or the caregivers understand what to expect and acknowledge the steps that can be taken, assess the patient's knowledge intermittently throughout the week to see if they're able to reiterate what was taught to them, and provide short list of questions to all the patients after the study to see if the SLP education remained with the patients throughout the process. Measurement number 3, measuring how the patients manage the SLP recommendations. Implement the appropriate feeding techniques for the individual patient, recommend the appropriate diet for the patient based on their degree of severity of their disorder, and record the observations in a research journal daily.